Welcome to everyone for a very interesting topic in pharmacology, roots of drug administration, presented by Dr. Naveen Gowda, consultant physician, diabetes specialist, and a senior resident doctor practicing in Bangalore. Before starting a topic on the roots of drug administration, we'll see a simple example. A patient comes with the eye infection like conjunctivitis. For this patient, should we give oral drug, oral antibiotic to cure the conjunctivitis? No, we no need to give oral drug. It is better to give topical drug. Like example, ofloxacin eye drop. Okay, for this conjunctivitis, because the topical drug reduces the systemic side effect when compared to the oral drug. Topical drugs are preferred when there is eye infection, ear infection, when there is bronchospasm, we give nebulization of this salbutamol. When there is skin infection, we write some antibiotic or the antifungal ointments, etc. Before moving on to the classification of routes of drug administration, I will just explain a basic concept about how a drug moves in a body. Okay. Example, when I give a drug orally, example, I have given a drug as a tablet form or a syrup form, the drug reaches the stomach and later reaches the intestine. See, weakly acidic drugs are better absorbed from the stomach, and the weakly basic drugs are better absorbed from the intestine. It is get absorbed through the portal vein and reaches the liver. In the liver, the drug get metabolized. Okay, drug get metabolized. Around 10 to 20% of the drug is lost. Then it reaches the systemic circulation. Around 80% of the drug reaches the systemic circulation. This 80% of the active concentration of the drug is called bioavailability. The drug, around 10 to 20% of the drug is metabolized in the liver, and this phenomenon is called first pass metabolism. It's called first pass metabolism. One is first pass metabolism, next one is bioavailability. Example, another example is when I give the drug in the injectable form. When I give the drug in the injectable form, the drug directly enters the systemic circulation. The drug enters the systemic circulation, bypasses the metabolism in the liver, and bypasses the first pass metabolism. It directly reaches the systemic circulation, and it will have a bioavailability, that is the active concentration of the drug, around 100%. Hence, the injectable dose is very less compared to the oral dose, because injectable forms have the 100% bioavailability. This is the basic concept we should know about. Before starting the topic, we should know about the bioavailability and the first pass metabolism. Then let us move to the two types of routes of drug administration. One is the local route of drug administration. One more is the systemic route of drug administration. One is the local route of drug administration, and second is the systemic route of drug administration. First one, local route of drug administration. In this, we have topical route. Okay. See, this topical route can be given. We'll now read about all the drug administration from top to bottom. Example, drug administered through the eye, ear, nose. Example, oflox eye drops for conjunctivitis. For the ear, we can give Oflox ear drops, gentamicin ear drops. For the nose, we can give already we know a famous example like Otrivin brand, like oxymetazoline. It is a spray or drops. It is a nasal decongestant. Okay, these are the topical routes given for the eye, ear, and nose. Next is the for the mouth. Example: when we get the mouth ulcers. Okay, when we get the mouth ulcers, we usually take lignocaine ointment, lignocaine based ointment. Okay, lignocaine, it will have other components with antiseptic and the lignocaine for the mouth ulcers. Next example: when there is oral candidiasis. When there is oral candidiasis, we give clotrimazole lozenges or mouth paint. Okay, for the candida infection of the mouth. These are the example of the topical route in the mouth. Next is the, let us see about the bronchi. So common cases we see in the OPD or casualty is the bronchial asthma patient. When there is a allergen trigger, they will present with the bronchospasm. To relieve the bronchospasm, we give salbutamol, budesonide, right? Nebulization when the patient is in the acute stage. It can also be given in the form of inhaler for the prophylaxis of asthma. See, we are just targeting the bronchospasm, the tissue directly, so that the systemic side effects are very, very less. Then fourth one is the skin. Okay, we commonly encounter so many fungal infection, bacterial infection. For bacterial infection, we commonly give mupirocin ointment, commonly given, and for the fungal infection, we usually give clotrimazole, fluconazole ointments can be given for the fungal infection. And also for the any itching, allergy, we can give calamine lotion. And so many other examples are there for the skin. See, here we are only directly targeting the skin infection without involving any systemic routes, so the systemic side effects are very less. Okay, then fifth one is the for the vagina. Commonly, ladies present with the vaginal candidiasis, intense itching. Itching is seen in the candidiasis patient. We usually give them clotrimazole. Can give cream or pessary. See, this is a clotrimazole pessary. See, this will be like a tablet form, like a pellet form. This is the tube which we have to place the tablet in this place, and we have to insert into the vagina so that it locally acts and clear off the vaginal candidiasis. Already we discussed that for the oral we have lignocaine gel or the lignocaine gel for the mouth ulcers. Okay, this is the ofloxacin antibiotic eye or the ear drops for the local action at the eye and the ear infection. Next one we will be talking about the rectum. Here we have two kinds of medications. Okay, one is the enema, one more is the suppository. See, liquid form of the drug given into the rectum is called enema. Solid form of the drug given into the rectum is called suppository. Example, see, this enema and suppository will have both local action and the systemic action. I will tell about both the things in the same slide. Example, local effect of enema. A common example, patient presenting to casualty with the constipation since 2 to 3 days, 3 to 4 days, not passing stools. Okay, we usually common in the old age patients. So water enema, it is like a osmolarity change causes the evacuation of the bowel. Soap water enema, it causes irritation of the rectal canal and causes the defecation. Then one more is the systemic use of enema. Systemic means, see here only local means only the we are causing the evacuation of stools. Systemic means now the drug given here should reach the systemic circulation for the systemic effect. Example, diazepam. Diazepam is an anti-epileptic drug. Diazepam enema given to the children's, because in small children's it is difficult to get the IV line. That's why for emergency purpose we inject the diazepam enema to the rectum. It will control the status epilepticus. This is a systemic route. It will enter through the hemorrhoidal vein into the systemic circulation. This is a local action soap water enema. Then suppository. One more local action. Example, bisaccordal suppository. Bisaccordal suppository is commonly used by the patient given for the constipation. Okay, constipation commonly used by the patient for the constipation. Sometimes it will be available as the over the counter drug also. Then systemic. This is a very important examples for the clinical practice. One is the paracetamol suppository. Paracetamol suppository are used in the small children's to control the high fever. Then one more is the indomethacin suppository used for rheumatoid arthritis. Rectal route. What is the main advantages of the rectal route? Advantages of the rectal route, it has quick onset of action. Okay, next we will discuss about the systemic route of drug administration. As we discussed earlier, only it was topical. It was targeting the eye, ear, nose, skin, and the any problems related to in the rectum region, in the vaginal region. Only it was targeting those through the topical route. Now is the systemic route. In systemic route, we have enteral route, parenteral route, and others. Enteral route. Parenteral routes are mainly injectables. Enteral route. Now we'll discuss about the enteral routes. Enteral routes, as it is in the name, enteral means the GI tract, the drug which is given through the GIT, then it will get absorbed into the systemic circulation. We will discuss the common examples. First one is the oral route of drug administration. It is the most complaint to the patient also through the oral route. Already we will be knowing that, like tablets, syrup, and so many other forms of examples are there for the oral. Okay, example: paracetamol tablet, aspirin, diclofenac, CPM, chlorpheniramine syrup. So many other types of examples are there for the oral routes. Okay, now we'll also, in this session, we also deal about the very important topic is the advantages and disadvantages of each route of drug administration. First one, advantages and disadvantages. First, talking about the advantages. See, it is cheaper route. See, parenteral route injectable are little expensive. It is cheaper route and it is safe for the patient to self-administer. The patient can self-administer and can use for repeated time. And it is painless. It is painless. See, parenteral routes injectable forms are more painful. Okay, and can't be self-administered. See, disadvantages of the oral route. As we know, see, already we discussed here. See, when we take a drug orally, the drug reaches stomach, intestine, then comes to the portal vein, then it reaches the liver, then reaches the systemic circulation. It will take a very long time for the drug to reach the systemic circulation. Disadvantage, it can't be used for the in the case of emergency. Okay, emergency purpose, we can't use this drug. We can't use in the unconscious patients having the nausea, vomiting, diarrhea. In emergency condition like high blood pressure, high blood sugar level, we can't use the oral route of drug administration. Other disadvantages of the oral routes are, first one is we can't give the drugs like insulin, because it is, when we given orally, it is destroyed by the digestive enzymes. Next one, we can't give highly polar drugs. Highly polar drugs like highly acidic drugs like heparin, and highly basic drugs like amino glycosides. These two drugs usually remain ionized in both in the gastric and the intestinal mucosa and are not absorbed. For a drug to be absorbed, it should be unionized form at the stomach or in the intestine, and it should be weakly acidic or weakly basic for a better absorption. This should be given through parenteral routes. And highly irritant drugs. Highly irritant drugs cannot be given through the oral route. Example: anti-cancer drugs. Okay, this can't be given by the oral route. These are the disadvantages of the oral route. Then we will speak about, before moving to that, I will show you few images of the enema. See, this is the enema solution we are injecting into the rectum for the local action like the soap water enema, or for the systemic action like a diazepam enema. This is a suppository, bis accordal suppository. It will be like a tube leg which should be inserted into the rectum for the, it is used for the treatment of, to reduce the constipation. Okay, one more is the paracetamol suppository. It's a common drug used in the pediatric age group for the eye fever. Okay, it has a systemic side effect, systemic effect. Next one is, this is the nebulization. What we read now, for the, when there is acute attack of asthma, we give the drug in a nebulization form. Example, salbutamol, budesonide, all the drugs, ipratropium bromide are the drugs. These are the bronchodilators given in the nebulization form to the patients. This is the nebulization form. Nebulization form. This is the tea bag. Mupirocin, this is for the skin infection, skin bacterial infection. We give tea bag ointment. Is an example. Okay. Then oral drugs. See, there are different types of oral tablets. One is the conventional type. Then is the oral dispersible tablets. See, if you are dispersible tablets, like when we keep that tablet in the mouth, it get dispersed. Example, Honden, Cetron, dispersible tablet. Then enteric coated tablets. See, certain drugs will be destroyed in the stomach. Okay, to prevent that, there are enteric coated tablets. Okay, then sublingual tablets. Next we will be discussing about the sublingual tablets, are the tablets which are kept below the tongue for the faster absorption. Then the buccal, the drugs which are placed in the buccal cavity. Then chewable. Examples are the lozenges for the cough. We give for the cough lozenges. Okay, to soothe the throat. Then control release tablet. Control release tablet means this one usually acts around for a long period of time. Then is the effervescent tablets. Effervescent tablets, a tablet we have to put in a small glass of water. It will get dispersed. It become like a liquid solution. Then we have to take it. These effervescent tablets are usually given for the gastritis. These are the different types of oral one. Then as we discuss about the oral form, then next important one is the sublingual route of drug administration. See, here the drug is placed below the tongue. Here the drug is, I will show you diagram. Drug is placed below the tongue. When we give the drug, the drug through the buccal mucosal membrane directly get absorbed into the blood vessels and enter into the systemic circulation. It is bypassing the first pass metabolism. Since it is bypassing the first pass metabolism, there is increased bioavailability and there is quick onset of action. Common examples for sublingual. Common example for the sublingual route. Example, nitroglycerin tablets. It is given in the sublingual form for the angina, acute attack of the angina. So what are the advantages of the sublingual routes and disadvantages of the sublingual routes? Advantages of sublingual routes. See, quick onset of action. There is quick onset of action. Then first pass metabolism is bypassed. It can be self-administered. When the patient is having an acute attack of angina, in chest pain, the patient can self-administer the drug, and the patient can spit out the drug. The patient can spit out the drug when the pain has reduced. See, this is the only route of drug administration where we can stop the drug action. Other routes, if we give any through IV route, IM route, in subcutaneous oral route, once drug given is given till its entire half-life finish off. But here after the pain get released, we can spit out the drug so that we can terminate the duration of action, terminate the drug action as needed. And disadvantages of the sublingual routes. See, irritant drugs cannot be given through sublingual routes. Irritant drugs and unpleasant taste drugs cannot be given through to the sublingual routes. These are the advantages and disadvantages of the sublingual routes. Next, we will see about the rectal routes. Okay, see, we already learnt about the rectal routes. Local effects like enema, like soap water enema. Systemic effect like diazepam for status epilepticus. Suppository local is the bisaccharide suppository for constipation. Systemic is the PCT for small children for high fever. Then indomethacin suppository for rheumatoid arthritis. Then let us talk about the rectal route advantages and disadvantages. See, rectal route has better bioavailability when compared to oral route. When compared to oral route, it has better bioavailability because it is bypassing the first pass metabolism, more of first pass metabolism. Second point, see, there is quick onset of action. There is quick onset of action. Certain gastric unpleasant drugs can be given through this route. What are the disadvantages? There is variable absorption. There is variable absorption of the drug. There is variable absorption of the drug. Second disadvantage is the little embracing. The embracing and inconvenience to the patient. So rectal advantages and disadvantages. Next, we will talk about the next one. We will talk about the parenteral. We now discuss the enteral route. In the enteral route, we have oral, sublingual, and the rectal. Next, we will now discuss about the parenteral route of drug administration. In parenteral route, they mainly is the injectable form. Injectable forms is like intradermal, intramuscular, subcutaneous, and intravenous, and other examples are also there for the injectable routes. Okay, now let us discuss the advantages. This is the advantages and disadvantages of parenteral route of drug administration. See, it's a very simple way to understand. See, what were the disadvantages of the oral route has now become the advantages of the parenteral route. See, oral route disadvantages were the emergency. See, it can be given in the emergency situation. The drug can be given in the emergency situation. Can be given in unconscious. Can be given in the unconscious patient. Can be given in the patient having severe nausea, vomiting, diarrhea, where there is absorption of the drug orally is reduced. Then it has quick onset of action. Okay, it is because the drug is directly injected into the systemic circulation. We can give the, see here, we can't give the drugs like insulin which are destroyed by the digestive enzyme. Here, insulin, the drugs which are destroyed by the digestive enzyme can be given through the parenteral routes. Next one, highly polar drugs were not able to be given by the oral route. Here, highly polar drugs can be given. Sixth one, there highly irritant drugs like anti-cancer drugs would have not been able to given by the oral route. Here, highly irritant drugs can be given through the one more is the drugs having high first pass metabolism. Drugs having high first pass metabolism. Example, lignocaine, morphine. These were the drugs which were not able to give through the oral route, can be given through the parenteral route. Next, what are the disadvantages of the parenteral route? See, main disadvantage is the aseptic condition should be maintained while giving the parenteral route of drug administration, while giving any injectable form. The procedure is painful and there is risk of damage to the nerve, muscle. There is a risk of damage. There is a risk of infection causing abscess during intramuscular injection or phlebitis. Phlebitis when we give the IV route. Fourth one, it cannot be self-administered as compared to the oral route. It can't be self-administered. These are the disadvantages of the parenteral route. Now, let us learn about the different parenteral routes one by one. Okay, parenteral routes of drug administration. Injectable forms. See, before learning the injectable forms, let us I will show you a diagram which is showing different types of injection. See, first, see, this is the epidermis layer, this is the dermis layer, this is the subcutaneous, and this is the muscle layer. See, when we are giving intramuscular injection, we should go perpendicularly, that is 90 degree. Then while giving subcutaneous, we need to reach the subcutaneous fat tissue, we should be 45 degree. Then if we are reaching the vein is in the dermis layer, we have to go 25 degree angle while giving the injection. See, intradermal injection usually need to be given in the epidermis layer, around 10 to 15 degrees the angle of injection. Okay, I will repeat, intramuscular injection is given at a perpendicular 90 degree, subcutaneous is given at 45 degree to reach the subcutaneous tissue, intravenous is given at 25 degree, and intradermal is given at 10 to 15 degree. Now let us learn about the each type of the injection. Intradermal injection, intradermal route of injection. Example, common example is BCG. BCG injection is given in the newborn baby. Okay. Is given intradermal. Then one more common example is the drug test dose. Test dose for IV antibiotics. Okay. See, usually IV antibiotics have more of hypersensitivity reaction. That's why we have to take 0.1 ml. We have to take 0.1 ml. We have to take 0.1 ml of the antibiotic drug which need to do the test dose and given in the intradermal area. Okay, a small bleb is formed. Okay, then we have to circle around the blood and write the times. Example, we are given at morning 10 o'clock. Okay, then after half an hour we need and we have to write what drug is given below. Example, we are giving ceftriaxone antibiotic. Okay, after half an hour we have to see whether any reactions is there or not. If there is redness, itching, then we have to stop giving the drug. If there is no reaction, then we can give the drug to the patient. This is called as drug test dose for the usually IV antibiotics, commonly done in the wards for the treatment of the patient. Next one, intradermal. Okay. Then second one is the intra. So before going to intramuscular, we will read about the subcutaneous route. Subcutaneous route, we have to go around the angle of 45 degree. For intradermal, what is the angle? Around 10 to 15 degree. Subcutaneous route. Examples of subcutaneous route common. Certain vaccines are given through subcutaneous route like MMR. Common example for the subcutaneous route. Other examples are we give heparin to prevent the DVT, emergency drug given through subcutaneous route, and also common example is the insulin. We give insulin through subcutaneous route. See, we should learn about even the sites of subcutaneous routes. What are the different sites of subcutaneous routes? See, different sites of subcutaneous routes are, we can give around the umbilicus. Then we can give in the upper outer aspect of the arm and the upper outer thighs and around and in the buttock region. These are the areas where the subcutaneous injection is given because of the subcutaneous fat is more. The subcutaneous fat is more in this region. Common example is the insulin. See, insulin is given in the pen form, already loaded cartilage, or in the insulin syringe. This is the insulin syringe given. Common example for the subcutaneous route. Let us now see about the advantages and disadvantages of subcutaneous route. See, advantage example, insulin. It can be self-administered. It can be self-administered by the patient when compared to other routes of parenteral routes. Then it has slower absorption and prolonged duration of action. There is prolonged duration of action. Okay, slower absorption, prolonged duration of action. Disadvantages. One more advantages is we can give depot injection. Depot injection example, Norplant. Norplant, it is a hormone, progesterone hormone given for the contraception. Okay, it will work for many days. Okay, no need to take repeatedly. It works for many days. Okay, this is a depot injection. Slowly the drug is slowly this depot injection get deposited in subcutaneous tissue and slowly the drug get released into the systemic circulation, has a very long duration of action. Disadvantages is that we can't give irritant drugs. We can't give irritant drugs through subcutaneous route, and it has slow onset of action. It can't be used for emergency purpose. It can't be used for the emergency. We can't use the subcutaneous route of drug administration. Next, let us see about the intramuscular route of drug administration. So intramuscular route of drug administration, what is the angle of giving the injection? We should give 90-degree because it has to pierce through the epidermis, dermis, subcutaneous, then you should reach the muscle layer. What are the common examples of the intramuscular injection? Paracetamol injection, diclofenac injection, then some anti-emetic drugs like ondansetron can be given through intramuscular injection, and certain vaccines is given through intramuscular injection. Example, DPT vaccine given in the children's in the intramuscular injection. Then rabies can be given through intramuscular injection, and the hepatitis B. Then we have to learn about the sites of drug administration. See, it is given in the deltoid region. Second, it is given in the vastus lateralis. And third one, it is given in the gluteus maximus muscle. See, deltoid and vastus lateralis is more preferred in children because gluteus maximus is not well properly developed in the children. There is risk of nerve injury. Okay, adults we can give to deltoid and the gluteus maximus region. After learning about the sites of drug administration, then we will learn about the advantages and disadvantages of intramuscular route of drug administration. Okay, first advantages is quick onset when compared to oral route. It is very quick onset when compared to oral route, but the quickest acting drug in this is the IV route. Then we can give mild irritant drugs, depot injections, and suspension injection through the intramuscular route. What are the disadvantages? See, we can give only small volume. See, around 5 to 10 ml. Usually 5 ml maximum. Usually small volume can be given. Example, around maximum is the 5 ml. Okay, but to give more than 10 ml, we need to go through the IV route. Second one, it is painful. Okay, other disadvantages same as the aseptic condition. Okay, and risk of nerve damage, risk of the nerve injury to the patient. So the disadvantages. Then aseptic condition, painful. Okay, then let us talk about the last important route, intravenous route of drug administration. Intravenous route of we would have seen in the wards how the intravenous route of drug administration is given. See, the IV line is placed in the vein. Okay, then the injectable drug is given through the IV line. Okay, this is an example for the iron infusion, iron supplementation for the treatment of anemia. Okay, common example how the this is the medicinal bag containing the medicine like iron supplement. Then through the IV line the drug is injected and the rate is controlled by the device. Rate of flow is controlled by the device. Then let us see about the examples. What are the examples of intravenous routes? See, common IV antibiotics, ceftriaxones, cefparazone, piptaz, amikacin are usually given by intravenous routes. Okay, we give pantoprazole. Pantoprazole is given by the intravenous routes. Okay, so many other examples are there. Then we will see about the advantages and disadvantages. Advantages and disadvantages of the intravenous route. First advantage is the, see, quick onset of action. It is the quickest onset of action because it is directly given in subcutaneous into the systemic circulation. See, intramuscular should is given to muscle. After muscle, it should cross the muscle, then go into the systemic circulation. It will take time, and it has 100% bioavailability. It has the 100% bioavailability because there is no first pass metabolism. First pass metabolism is bypassed. Then highly irritant drugs which was not able to given in the other routes of parental routes can be given. Example, anti-cancer drugs. Hypertonic drugs can be given through the IV line. Example, 20% mannitol. 20% mannitol for the cerebral edema. For the cerebral edema. Then we can give highly irritant drugs, hypertonic, 100% bioavailability, and is the line of choice in the parenteral line of choice for the emergency procedures. Example, patient is unconscious, unresponsive. Okay, then there is high fever, low or high blood pressure, sugars. Okay, in all these emergency condition, IV is the route of choice. IV is the route of choice. Then what are the disadvantages? There are few disadvantages, like, see, there is a chance of phlebitis. Phlebitis means inflammation of the veins. Okay, it's common when we give IV routes. Then sometimes few drugs, when there is extravasation can cause extravasation of drugs. Extravasation of drugs can cause necrosis. Example, noradrenaline. Then strict aseptic condition should be maintained. Strict aseptic condition to be maintained. These are the various routes of drug administration. Then there are few others route of drug administration. Example, inhalational. See, we already already saw about the local routes, like the salbutamol inhalation for the asthma. There is systemic. In the systemic route, we have general anesthesia for the general anesthesia given before the surgical procedures. Next one is the intra-arterial route. Example, radio opaque dye for cerebral angiography. Next one, third one, intra-articular route. See, the drug is directly injected into the joint. Example, in rheumatoid arthritis, there is this inflammation of the joints, hydrocort injection is given directly intra-articular for the rheumatoid arthritis. Last one, we will it's a very important one, is the transdermal route of drug administration. Transdermal route of drug administration. See here, the drug is administered in the form of patch, and the drug directly enters into the systemic circulation. Okay, I'll show you a good diagram showing the illustration of the transdermal drug delivery system. See, it is a patch of which usually placed over the arm region or behind the ear pinna. Okay, and many other places can be placed. Okay, this is the illustration of transdermal drug delivery system. See, it has 4 layers. One is the adhesive patch. See, it is a patch. Okay, it should stick to the skin. This is adhesive patch. Above the adhesive patch is the rate controlling micropore membrane. This is the rate controlling micropore membrane. This is the drug. We have drug in the drug reservoir membrane. Above is the backing film. See, drug directly from the patch through the skin enter into the systemic circulation. Since it is entering into systemic circulation, it is bypassing the first pass metabolism. Then let us see some good examples of the transdermal route of drug administration. First very important example is the scopolamine patch used for the motion sickness. Scopolamine patch used for the motion sickness. Then nitroglycerin patch used for the angina prophylaxis. Then nicotine patch for the smoking de-addiction. Next, let us discuss about the advantages and disadvantages of the transdermal route of drug administration. See, simple, it is bypassing the first pass metabolism. Then it has steady plasma concentration because slowly the drug is released into the systemic circulation. Slowly the drug slowly released into the systemic circulation, means there is a steady plasma concentration. Third one, self-administered and patient is more compliant. What is the disadvantage? There may be irritation, and this patch is very expensive. Third one, the patch may peel off without knowing. This was the main disadvantage of the transdermal route. Thank you guys for listening. Please do support by liking and sharing the video. Thank you.